Okay, the India is one of them. It occurs in young individuals, mostly 15 to 30 years. Type 2 is 30 to 50 years, or even 60 or 70 also. In this 15 to 30 years, people are mainly affected. Here, people are very thin, lean, and malnourished. So, the type of diabetes mellitus is also seen. It's just that pancreas could not produce enough insulin. It is mainly due to necrotic tissue of pancreas or necrosis, any necrosis in the pancreas. So, individuals need insulin. Okay, hormonal disorders also will takes place in these persons. When insulin is discontinued, complications are lesser than the type 1 diabetes mellitus, because in type 1 diabetes mellitus we will observe children and adolescents, they have no insulin is produced, no single insulin is produced in them. Here, produced but not enough is produced, means very little amount is produced, which is not enough for the body or tissues to take up the sugar, and means complete sugar will not be taken. Some amount of sugar is left in the blood. Next one is impaired glucose tolerance. Glucose tolerance is assessed by taking the fasting blood sugar value. See, glucose tolerance is mainly glucose tolerance is assessed by taking fasting blood sugar value. It's just that we ask patient to do a fasting blood sugar value. After that, an oral glucose level of 75 grams of glucose is administered, and blood sugar is generally checked after 1.5 to 2 hours. If we check the value against the normal or fasting value, if the values are above normal, this then we describe the condition as impaired glucose tolerance. That is, they have risk of developing diabetes in later stage. Individuals are free of symptoms of diabetes, means body is coping up to meet the level to decrease the sugar, but they are not completely remove the sugar from the blood and helps to intake the tissue. But this is the stage they could develop the diabetes if they are unable to control their diet or exercises. See, regular exercise help in blood sugar level. Glucose tolerant patients, the persons who has condition to glucose tolerance, mean they have very high risk of getting type 2 diabetes mellitus. Okay, if they have change in glucose tolerance condition, if they have maintain the regular exercises and decrease the weight and everything, chances are to be reduced, but it's not completely avoidable. Chances were reduced if they continue to do everything like that, in whatever they wish, their chances are very high risk of getting diabetes mellitus type 2. Okay, now the new one is gestational diabetes. See, when a pregnant woman develops the diabetes, it is called gestational diabetes. It means the pregnant woman will be getting diabetes after being, if a woman gets diabetes after being pregnant and after delivery, some people gradually reduce the symptom of diabetes and they will be free from diabetes. In some people, they will continue, it will continue to be in diabetic condition only. It's already saying it occurs only 1% of pregnant women who have risk of diabetes because of family history or bad obstetric history. screened for diabetes. Pregnant mother could help diabetes related complications of delivery. See, I already told you, in some people, symptoms or anything they developed in their pregnancy, diabetics related. In some people, it can subside, but in some people, even after delivery, it may continue. See, beside this type of diabetes we have discussed, there is another type of diabetes, namely maturity onset diabetes of young. Means it refers to several rare hereditary